I'm going to introduce Dr. Doug Blomeley. He's a psychiatric registrar currently based with Barwon Health. He holds a position as a clinical lecturer at Deakin University School of Medicine and a strong interest in rural and regional medical practice and education. In addition to general psychiatry, Doug's clinical and research interests include eating, body image, and anxiety disorders. Doug will be talking about how to approach a scholarly project. Welcome, Doug.
I do have to be upfront, about my conflicting interests. David Castle was my scholarly project supervisor, so I've got a bias there. But nevertheless, on a serious note, I think it's important that I'm sure I speak thanks on behalf of all of the registrars here as well as myself. That we're very appreciative to Sunil and the team at PsychScene for arranging the day. So thanks very much, and obviously to Servia as well for your support. We can all graciously accept it in good conscience. Contributing to all of our education. So this talk won't be quite as intellectually challenging as some of the others, so you might find it's a nice way to finish up, and it probably won't go the full hour either, so but we'll see how we go. The scholarly project, I passed mine this year. I'm at the end of third year, and it's on the ground, and speaking to a lot of our colleagues, it's a bit of an unknown, being a relatively new requirement. Under the 2012 regulations, there's not a lot of people reportedly that have done projects, so it was a little bit difficult to gauge, what sort of things can be done and what's the standard, how do you go about it. So we thought it might be a reasonable way to try and disseminate some sort of practical information and my reflections from having done this with regard to, hopefully some helpful tips for everyone else. So just briefly to recap, I haven't gone into too much detail here, but most of you will know that the project, it is a sort of 3,000 to 5,000 word requirements. I dare say that almost all of them are going to fall towards 5,000, and even then it might be a little bit difficult to contain it to that. But whatever you do, it can take a variety of forms, such as a literature review, an audit, a quality control sort of thing, a case series, gathering your own data, some sort of original research, or you can indeed apply, if you've got a reasonable idea, to submit a so-called equivalent other project. And there's a bit of an unknown really as to what equivalent other projects might encompass as well. So there's a lot of options, and you can, very importantly, if this applies to you, apply for an exemption. I think the requirement is to have submitted a peer-reviewed publication within the last, I think it's 5 years, it might be 10 years, of which you almost certainly will have had to be first author, and you can apply for an exemption that way. And if we think about the project in terms of the CanMeds framework, this sort of satisfies predominantly the scholar requirement, also probably verging into the realm of the communicator with your written sort of high level of communication. So that's some of the justification from the college's perspective. Just for interest, how many people need to do a project? Yeah, so a reasonable amount. Yeah. In some ways, this can, I guess, kind of be seen as replacing what was the first presentation case under the 2003 regulations. So this is the 2012 equivalent. And again, often 3 rounds of marking per year and the sort of obligatory 3-month wait for your results. And again, talking to directors of training, trainees and various other people, the scholarly project is sort of viewed as something that might have potential to become a barrier to progression through training, in terms of, I think it's something that's pretty easy to potentially sort of avoid and think, I'll get to that at some stage, and before you know it, you're in final year and you haven't thought of a topic and it's all a bit of a rush. So that's something that we will sort of talk about. So that's probably not only my initial experience, I think that's probably me still. I'm convinced I only passed because David was my supervisor, but he tells me otherwise. But I think for someone who hadn't done any research at all, it's a pretty daunting sort of experience, I think, doing the scholarly project and approaching potential supervisors at my previous employer. People sort of recoiled in horror when they were asked about the possibility of supervising a research project. So it's something that I think can be daunting not only for trainees, but potentially a lot of consultants as well, if they don't have a strong research background, and they may feel out of their depth in supervising us with this sort of thing as well. So I think if you're finding the scholarly project an anxiety-provoking experience, you're certainly not alone. So don't doubt that for a moment. But just to give you a bit of background as well, my topic was a little bit obscure. So it was a systematic review on the classification of muscle dysmorphia. So, a fairly, not a particularly common topic. And the question I essentially asked was, well, what's the most appropriate way we can classify this disorder and why? What's the underlying core psychopathology? Which, as you can see from my relatively brief summary, that it's a distorted perception of body image with the focus being on insufficient muscularity driving associated behaviours that are trying to achieve this sort of unrealistic performance ideal. But throughout the literature, I found that there was this ongoing debate. No one could really agree. And perhaps given the nature of the disorder, can we create this new category within the limitations of classification systems that might better encompass this and some other relatively closely related disorders? And I think Professor Castle made his position on classification systems reasonably clear. But nevertheless, this was a factor in the project.
Are you okay to take?
Yeah, please interrupt away. And
Yes, sorry to interrupt. I'm very ignorant about this. This is people who are. This is the opposite of anorexia.
it was originally described as so-called reverse anorexia. Yeah, so the cognitions and the behaviours are very similar, except they might go in different directions.
So these people are not thin. They're actually
Most of them
bodybuilders that want to get
enormously
bigger?
muscular.
Okay.
There is a variant where it's not so much focused on muscularity, it's on body fat percentage, so leanness rather than muscularity. But the vast majority are pursuing muscularity at a very low body fat. So it wasn't an autobiography, by the way, despite some people's questions. I'm sure there's a degree of identification, but I don't meet criteria. So I won't rabbit on too much about muscle dysmorphia. It's an interest of mine, but not necessarily everyone else's. So that's just to give you a bit of an idea of even an obscure, weird, possibly irrelevant sort of topic did get approved and did get passed in the end. So whatever you're thinking of, it's probably a reasonable suggestion. But in terms of the practical questions, the actual thinking of your topic, coming up with your plan, well, what the hell am I going to do for this project? I think possibly one of the most important things, that's why it's at the top of the list, is this a topic or an area that you enjoy? I think this is a pivotal aspect. The project has potential to be, I think, fairly painful. I did find it difficult to become excited about doing a research project, but as I progressed through, I kind of became quite enthusiastic about it, surprisingly enough, but I think it has to be a primary consideration. What is something within psychiatry? I'm sure you can all find something that you find is really interesting or stimulating or that you want to know more about. Even better, is there a supervisor around? It doesn't have to be within your health service. That was certainly the case for me. Is there someone around that shares this passion and this enjoyment about this particular topic? It's an added bonus if that same person also has a degree of research expertise. That would be, I think, enormously helpful in your undertaking of the project. And I actually had a co-supervisor as well who was the director of research at St. V's, who works closely with David, and their librarian also got on board to help. So it kind of summoned this team of people to help the incompetent registrar get through a research project. So it did involve doing a little bit of grunt work on another publication that they did, but I think you've kind of got to pay your dues to get help from people sometimes. So I wouldn't be surprised if there is a little bit of that involved for you as well.